Welcome to Unit 9, Introduction to Hematology and Coagulation. Hematology is one of my absolute favorite departments to work in. And coagulation is fine, but the principles can be very challenging to learn. Hematology, by definition, is the study of the formed elements of the blood, and this includes red blood cells, white blood cells, and platelets. So in your circulatory system, all of these three will be found. This also includes the study of the nature, function, and diseases of the blood and blood-forming organs, such as leukemias or anemias. So in hematology, you will learn how to classify, enumerate, and then determine the clinical significance of each of the formed elements of the blood. The complete blood count is the most commonly performed hematology test. And it's not a single test, but it's a panel of multiple tests, which includes the red blood cell count. Red cells, as you can recall from your high school biology, are those cells that carry oxygen to your tissues, and then they pick up and remove the carbon dioxide. The white blood cell count, when you're sick, a high white count may indicate a bacterial infection, while a low count may indicate a viral infection. Platelet count. Platelets assist in clotting. When you cut yourself, these cells help form a plug to prevent significant blood loss. So if you don't have enough of these, they can't function, and you may not be able to stop bleeding. Hemoglobin is the reddish color substance inside your red cells, and it's an indirect measurement of the iron in your blood. And iron is what gives your red cells the red color. Hematocrit is the percentage of your blood which is red cells. So you need to have a certain percentage of red cells. If it falls below that, then you're considered anemic. You don't have enough. A differential is where we put a drop of blood on a slide, we smear it to where there's a single layer, then we stain it, and we actually count 100 white cells, and we note the different types of cells that are present. There's 5. And the percentage of these different cells, depending upon your health status, will help the physician determine, again, what type of infection they're dealing with, whether perhaps it's a viral infection or a bacterial infection. There are other results which are included in the CBC, and these results are calculated based on the hemoglobin and hematocrit results. And the calculations are done to determine the size of the red cell. We want you to have a normal size. If you have too big of a cell or too little of a cell, this could indicate some type of disease process. And the hemoglobin concentration of each individual red cell. So again, these parameters, you are taught what they mean, the clinical significance as they apply to disease states, and then again, these results are provided to the physician to aid in the diagnosis and treatment of disease. So the results of a CBC can determine whether a patient is anemic, has viral infection or bacterial infection, has leukemia, or a myriad of other types of blood disorders. So let's talk more about red blood cells. These are produced by the bone marrow, and of course bone marrow is found in your long bones. Their primary function is to carry oxygen to the tissues, pick up the carbon dioxide, and take it to the lungs where gas exchange occurs. Carbon dioxide is released when you blow out, and O2 is bound when you breathe in. So there's this constant exchange in the lungs of these two gases. During the study of hematology, you will learn the maturation process for red blood cells and how to recognize the microscopic differences in the cells in a series in peripheral smears. A peripheral smear is one where we put that drop of blood on the slide, smear it out to a single layer, and stain it. Normally, only mature red cells are seen on a peripheral smear. Premature red blood cells usually indicate a disorder, and usually it's some kind of anemia or red cell dyscrasia, a disease of the red cells. This is just for your information, but these are sample pictures of the red cell as it matures in the bone marrow. So sometimes you may be able to go with the doctor and actually observe a bone marrow being done. It's done to finalize diagnosis of certain diseases, and that's really the only time you'll see the top row of these cells, unless patient has cancer of the blood. Then we may see these premature forms. I want you to draw your attention to the bottom pictures. In the bone marrow, red cells have a nucleus, but once, right before they're born, the nucleus comes out and the red cells released into the circulation. In some cases, when you become anemic, the need for oxygen is so desperate that the bone marrow will start releasing red cells with the nucleus in them. And this is not good. You know, when you see a nucleated red cell in the peripheral circulation, this is not a good sign. And it's just an additional indication that something's going on with the patient. If you'll notice on the last to the right picture, the reticulocyte, these will have a little bit of bluish because it's called a supravital stain, and the stain we use will stain nuclear material blue and then other elements of different colors. You can see the hemoglobin is red. So when you see bluish type cells, that means those are newborns. Those are baby red cells. And then they will eventually have that biconcave shape and be of reddish color, have an area of central pallor. And we look for a normal size central pallor, because if it is too large, that means there's not enough hemoglobin or iron in the blood, and that's a sign of anemia. So much can be learned from looking at a smear made from a patient's blood. One of the most frequently diagnosed conditions in the hematology department is anemia. And anemia is a condition marked by a deficiency of red blood cells in the blood, resulting in symptoms of pallor. The patient is very, very pale. Tiredness, because they have fewer red cells, they're not getting fully oxygenated, which leads to being tired as well as weak. And there's other symptoms. So I thought I was just getting old, and we did some testing, and sure enough I was anemic, but fortunately it was something that was easily treated. The red blood cell count, the hemoglobin, and the hematocrit are performed on the blood to aid in the diagnosis and classification of anemia. If the numbers are low, this is an indication of anemia, and there's many, many different types of anemia which you will learn about. There's different causes. There's iron deficiency. There's vitamin B12 deficiency. There's folate deficiency, and these can all cause different types of anemia. The reference ranges or normal values for these tests will differ for infants, children, men, and women. So babies have very, very high red cell counts, and children, it will then fall off to varying levels, and then you finally reach your adult. And men and women differ, and that's because women have their menstrual cycle. So every month they lose blood, so their hemoglobin hematocrit levels are not going to be the same as men. A vital part of your education will be the memorization and interpretation of laboratory values. It's crucial that you, as a medical laboratory technician, be able to associate the laboratory results with the disease states, because many times you can then determine what additional tests need to be performed to assist the physician in this diagnosis, because you know what those tests mean. Correlate the laboratory results obtained in different departments with disease states. For example, if you suspect the patient has iron deficiency anemia, go look up the chemistry department, because you're going to expect the iron levels to be decreased. So all the pieces have to fit. I liken it to working a jigsaw puzzle, which I love to do. So you take the piece from chemistry, and you take the piece from hematology and other areas as needed to put together a clinical picture for this patient. That's what makes our job fun. We are detectives. And again, determine additional tests to perform when abnormal results are obtained. Let's talk about the white blood cell count. And the white blood cell count provides vital information to the clinician. And LEUKO means white blood cell. So leukopenia is a low white count, leukocytosis is a high white count, and leukemia is cancer of the blood with malignant white blood cells, and it has an extremely high white blood cell count. And no matter what cancer you have, cancer is an extremely rapidly growing abnormal tissue based on your normal cells. Unfortunately, in the bone marrow, when this rapid growth occurs, the white cells are released very early, and depending upon the type of leukemia and the stage of the leukemia, there are massive quantities. For example, a normal white count is 5 to 10,000. When a patient has leukemia, I've seen counts in the hundreds of thousands. And when you look at the peripheral smear, the majority of those cells are very, very early forms of the white cell. Correlating the WBC count with the predominant cell type found in the differential aids the physician in the diagnosis. So again, a low WBC count with predominantly lymphocytes is found as an indication of a viral infection. A moderately high white count with predominantly segmented neutrophils, which is one of the 5 types of white cells found in your blood, is an indication of a bacterial infection. So these 2 counts, along with the differential, will point the doctor in the right direction. Let's say, and I admire doctors so much, you go into the doctor's office and say, I feel yucky. And so you tell them your symptoms. So you have a high-grade fever and lethargy, and I just don't feel good, doc. So they're supposed to take that information and turn it into a diagnosis. So this is why having an exceptional doctor is so important, because they've heard all these signs and symptoms before, or maybe there's something in the community going around, and if they can't really determine based on the quick strep may be negative and this and that, they may order a CBC just to determine, okay, are we dealing with a virus which must run its course, or are we dealing with a bacterial infection which needs antibiotics? And then we've talked about the extremely high white count with very immature white cells, that would indicate leukemia. The last type of cell we'll talk about, again, we've talked about red cells and white cells, are platelets. And in the bone marrow, the platelet precursor, the baby platelet, is called the megakaryocyte, and it is the largest cell in the bone marrow. But upon maturation, this cell breaks up into thousands of platelets, and these are also known as thrombocytes, and these are released into the bloodstream. So again, in the bone marrow, the megakaryocyte is the largest cell in there, but once the platelets mature, they are the tiniest cells in your peripheral circulation. Their primary function is to participate in the clotting process, which is called coagulation. When a blood vessel is damaged and leaking, they rush to the site to form a plug, which prevents blood from escaping. Thrombocytopenia. Thrombocyte is platelet, penia is decrease. So this is the term used to indicate an extremely low platelet count, which unfortunately can lead to spontaneous bleeding and bruising. In fact, if you notice you or a loved one have bruising not associated with falls or injuries, your teeth bleed after they brush, you're getting bruises all over your body, it's time to go to the doctor, because a decrease in platelet could be a sign of a very serious condition. Although platelets are part of hematology, the conditions and disorders are studied more fully in coagulation, because they are a cell that we look for in a peripheral smear, but their function is part of coagulation that helps you stop bleeding. A differential is part of the complete blood count, and is performed by microscopically examining a blood smear and enumerating each of the 5 types of white cells present in 100 cells counted. The clinical significance of each of the white cells is as follows. Segmented neutrophils, these are always high in bacterial infections. they play a key role in defense against invading pathogens, which a pathogen is defined as a disease-causing microbe. So if you've ever seen phagocytosis, they will actually go out and engulf and destroy the invading microorganisms to the extent possible. And most of the time in normal situations, this is why you don't get sick. Because if you're just exposed to a few microorganisms, your body's defense mechanism can take over. But if these pathogens grow rapidly in number, then it overwhelms and then you get an infection. But again, that's why these numbers go up, because your body's trying to fight off that infection. Lymphocytes, they're high in viral infections, and there are several subtypes, and each with a specific purpose. So again, your body is wonderful. The immune system is wonderful. We have one type of cell that's associated with bacterial agents, and we have another cell type that will find and destroy viral agents. But again, if the viral agents become too high in number, it overwhelms your immune system, and then you get sick. Eosinophils are the most beautiful cell, in my opinion, and these are high in allergies and parasitic infections. Monocytes are also a type of phagocytic cell. They're really found in very low numbers in the peripheral blood. Their primary job is in the tissues. So let's say the microbe escapes and gets into your tissues. Well, here's another line of defense for you to try and overcome that infection. Basophils, they're rarely seen in the peripheral blood. They're located outside the circulatory system in the connective tissue. Their granules contain histamine, and during allergic reactions, they release the histamine, which cause the miserable allergy symptoms. And that's when you go to the drugstore and you buy a medication called antihistamine. Because again, this is an inappropriate large amount of histamine being released. They also contain heparin, which is a natural anticoagulant. So during your study of hematology, you will learn to describe and identify the maturation cycle of each type of white blood cell. You will also learn about the clinical significance. What does it mean when they're present in high or low numbers so far as the patient's health? And diseases which may be found within each type of white cell. Fortunately for you, there are a tremendous number of resources on the internet which will assist you in the task. So this is a line drawing which shows you the different types. The monocyte, the eosinophil has these large orangey granules in them that are beautiful. Basophil, they have large blackish granules. Again, lymphocytes, there's different types depending upon what job they're doing, what organism they're dealing with. And then the neutrophil, which is, again, your first line of defense against microbes in your peripheral blood. This is just an illustration. I would never expect you in an intro course to know the maturation cycle, but I just want you to know this is what you will learn in MLT, and it looks very complicated, but the instruction that we will give you will make this very, very logical, and we'll find ways to assist you in memorization of the different maturation cycles of the different types of cells. Automation is utilized extensively in the hematology department, and the complete blood count is the most commonly performed test on the analyzer. These instruments require daily tests with control materials to ensure they are working properly. So, doctors and nurses do not run your lab tests. We allow them, the law allows them to run tests that the results, if they're incorrect, will not be fatal to a patient. Otherwise, you have to meet very high qualifications to run this type of equipment. Just because the machine puts out a number doesn't mean it's right. And so every day, the first thing we have to do is we run samples of known values, high, normal, low, and they have to give us results within certain parameters to say, hey, yeah, your machine is working properly today. If those results do not fall within the manufacturer's ranges, we cannot test that patient sample. That means something is wrong with the machine, and the results that we get are not going to be accurate. The results of the quality control are carefully analyzed to not only determine problems occurring right now, but to identify problems occurring over time. So let's say that we have this result, and today it's 50, and then tomorrow it's 45, and the next day it's 40, and the next day it's 35. So even those fall within the ranges of normal for that control, there's something going on because every day that value is lower. So we are analysts. We are provided with a lot of data, and as an MLT, every day you use critical thinking skills to analyze and determine accuracy of this data. A calibration must be performed every 6 months with special calibrators to maintain accuracy of results, because over time our analyzers, due to just use of the instrument, things can kind of trend out of whack. So the calibrators ensures it brings it back into whack to where the results once again are as accurate as we can make them. These analyses are some of the most important that you will learn, not only for hematology, but these types of procedures, quality control and calibration, apply to any instrument utilized in the clinical laboratory. It's not simply about pushing the buttons. I can bring anybody in and say, okay, put this sample, push this button, voila. No, but you will scientifically analyze the data that's produced by the instrument, because our goal is to provide the most accurate results on this patient as possible, because their lives depend upon it. The next department I'd like to talk about is coagulation. By definition, coagulation is the action or process by which blood changes from a liquid to a gel, forming a clot. It potentially results in hemostasis, and hemostasis is a steady state of remaining the same. So what we want is our blood to remain in our circulatory system and not wander out due to a cut or some type of trauma. This begins almost instantly after an injury to the blood vessel has occurred. You have this alarm system that when that is breached, let's say you cut yourself with a pair of scissors. Well, immediately this will signal a complex process that involves a number of different coagulation factors in your blood. And it's often called a cascade, as the individual factors work in a specific sequence of activation. This becomes activated, which will then activate this, which will then activate that. So imagine that you've lined dominoes up, and each domino is a different factor. Then when you tip that first one over, it goes to the end, and at the very end is clotting. Hemostasis is the process which causes bleeding to stop from a damaged blood vessel, followed by repair. So not only do we want to stop the bleeding, but we need that injury to be repaired so that bleeding will not continue. During the coagulation course, you will be required to memorize the coagulation cascades. They look daunting, but by researching the internet, you will find tips and tricks to help you memorize the different factors. And I want to emphasize that the more you put into your education, the more likely the area you're studying will stick in your brain, because you have actively participated and made that learning object in your brain. And this really applies to any class that you're taking. The next slide illustrates the activation sequence of the different clotting factors involved in 2 different pathways. And there's the intrinsic and extrinsic pathways. Again, in this intro course, I would not ever have you memorize this. But I just want you to know that as a medical laboratory technician, there is a lot of physiological knowledge that you need to have in order to understand and interpret the testing that you're doing. So the coagulation department performs blood clotting tests used for diagnosing problems with hemostasis. Coagulation testing may be performed for a variety of reasons on patients. The top one is for patients who are on anticoagulant therapy. And I hate the term blood thinners, but that's what they call it. Anticoagulant therapy, such as heparin, does not thin your blood. It prevents your blood from clotting by binding up some of those coagulation factors. Remember the domino? If one domino is missing, clotting will not occur. So those people who are on blood thinners need to have their blood tested on a regular basis to ensure proper dosage. If they don't get enough of the anticoagulant therapy, they may form a clot which may go to their brain and they die. If they get too much, they may cut themselves and then never stop bleeding. So coagulation tests will help the doctor determine the amount or the prescription needed for their anticoagulant therapy. Patients who have hereditary bleeding disorders, the most common one is hemophilia. They're missing a certain factor, and with certain types of injuries, they start bleeding and they don't stop. Patients having excessive bleeding due to some type of trauma. Because when you have trauma, let's say in your car wreck and you have abdominal injuries, you may use up all your clotting factors trying to stop these huge wounds. So coagulation testing will let the physician know if it's time to start giving products that will replace your coagulation instrumentation. These instruments are programmed to perform specific tests, with PT and PTT being the most commonly performed. Although, again, there are many others that can be added to the menu of tests. Just like hematology, the size of the instrument will depend upon the volume of testing performed. Large analyzers for high volume testing like hospitals, and small tabletop models for low volume testing. For example, cancer clinics, they monitor patient coag because this is one of the systems that are affected by chemotherapy. There are even small handheld devices for point-of-care testing. Point of care is that this test is done at the patient's bedside. Just as glucose testing is frequently done by patients with these small devices, the PTT can also be done on a small device. And my mom, she didn't drive, and after my dad passed, she just wanted to eliminate visits, and she had to get, she was on anticoagulant therapy, so had to have a test done every month. And she would go in and they would use this handheld device, and she said, I want one of those. So, well, and this was 10, 15 years ago. Well, you got to get a prescription from your doctor, and Medicare has to approve it. And she said, I don't care, I'll buy it myself. And back then the instrument was $5,000, and she bought her own and then ordered the strips, and once a month I taught her how to perform the test. But again, it's just one way to free patients from having to go to the doctor. And nowadays, with all these infectious agents going around, the more they can stay at home, the safer they are. Here's two reference sites. One is a website about point-of-care analyzers, and you can see they're just not for coagulation, but many different areas. And then there's an article on point-of-care testing for hematology and coag that you may find interesting. So this is the end of the presentation. Please let me know if you have any questions.